Dr. Argy, it's so good to see your face again. How are you?
I am doing very well, and I am delighted to be interviewed and follow up when we're getting to the good part.
Yeah, we're finally getting to the good part, right? It's been a crazy year, but for those of you just tuning in and joining us for Marketplace Mondays in May, this is our good friend Nicholas Argy. He is an MD, a JD, a physician, a lawyer. He likes Greek food. He's got kids. He's awesome. He's got opinions, and we're going to go from there. How about that?
Works for me.
We talked to you last year on Marketplace Monday or Marketplace last year when we did this, and we were discussing the pandemic. We were at the very beginning of this global pandemic, so we had no idea what was going on. But people like you actually did have some idea because you've been around things like this. You've studied this. You know, this is your world of decades of talking about things like this. And it's been a crazy year. All the credit unions, like most businesses, have dealt with so much stuff. And now here we are sitting in May, and we're still dealing with this pandemic. I'm just going to ask the question, Dr. Argy, how do we end this pandemic?
So, there's so many questions that are still not known. And the problem is there are just too many variables to really be able to confidently say we're coming to an end. I'll have to tell you, all the factors are looking in the right direction. I mean, the case rates are going down. We're probably just under 30,000 new cases a day, which unfortunately is still very, very high. But it's much better than what it had been, where we were having sometimes over 100,000 cases. The death rate is under 600. But here's the unknowns. The unknowns are we get one variant because we're still not aggressively containing this virus. If we get one variant that's gnarly, meaning it's easily transmissible, it's more lethal, and all the vaccines we've currently taken aren't very effective against it, well, you know what? We're back at ground zero. So I don't want to be a naysayer. I mean, let's hope that none of that is true. But I think people are prematurely letting their guard down, including the CDC. So I would just tell people, please still be cautious. There's just too much bad misinformation being given out there, and people are just ready to celebrate prematurely.
We're talking to Dr. Nicholas Argy. He's a physician, a lawyer, a good friend of ours here at the Cooperative Credit Union Association. After decades of all of your work at hospitals, whether it was Brigham and Women's, whether it was the chairman of the radiology department at Cape Cod Hospital, you took a step back because you like to educate and you're really an advocate for patient safety. So let's do this. I want to play a clip here. We were watching an interview on MSNBC recently with a gentleman. His name is Larry Brilliant. He's an epidemiologist, and he had this to say about herd immunity. Watch this tape.
We won't get to herd immunity. We won't ever get to it worldwide. We won't get to it in the United States, if at all, faster than the variants will come back at us. And we need to have another set of tools in outbreak containment, the way we did in smallpox, where we did surveillance and containment. We eradicated smallpox in places that only had 20, 25%, 15% of people immunized. And we need to add that along with the wonderful vaccines, the miracle vaccines, the mRNA vaccines, the terrific rollout that Andy Slavitt and others are doing, almost 3 million vaccinations a day. It's really phenomenal. But on top of that, we really need to add better outbreak control, the way we did in smallpox. And I would add in Ebola a couple of years ago in the Congo.
Dr. Argy, your thoughts on Larry Brilliant's comments there about herd immunity?
So, I think the comment that we won't get to herd immunity, I think he's made the comment for two reasons. One, it makes a great soundbite. I mean, what a great soundbite. Everybody's been waiting for the holy grail of herd immunity. Now we have an expert saying we won't get to herd immunity. So people listen, and that's probably why you played the clip. So I will say the following. One, people need to understand that herd immunity is not a switch on, switch off. It's a pendulum of when we get to 99% of people who are vaccinated, well, you can't spread the disease because only 1% are left. You'll still get a handful of spreads from the 1% to the 1%, but it would be exceedingly rare. So they're saying now that herd immunity for the United States should be in the 80% range. And I think, with either vaccination or natural infection, recognizing there's an overlap of a couple of those. But we're getting there because the numbers show that we're getting there. We're not there yet, but we're close. But I'd love to just see 99% of the population or 100% of the population just get vaccinated. Then we don't even have to talk about herd immunity. And of course, the comments about variants just parallel what I said earlier in the show. Basically, that if we get variants, it's a whole new world that we're starting at. There hasn't been discussion of how often we'll need boosters. The reason for that is we don't know. And again, the slower we get the spread to be completely eliminated, that eliminates variants. The reason you get variants is because more people are getting it. The virus has a chance to reproduce. Every time the virus reproduces, there's an opportunity for a variant to form. So that's why it's so crucial to take this seriously, to not let our guard down. But I think the comments in general are accurate by Dr. Brilliant. I just think that we need to sort of keep emphasizing, because the rest of the world will get there too, hopefully with our help. But we need to work harder and smarter.
We're talking with Dr. Nicholas Argy. He is a physician, a lawyer, a good friend of the Cooperative Credit Union Association. Lots of knowledge when it comes to this pandemic, what we shouldn't be doing. You've touched on a few things already just a few minutes into this interview. I want to go back and talk about the booster shots. Obviously, we've spent so much time getting to where we are. There are 3 different options as of now, probably more coming, where we have, these vaccines. Talk about the reality of potentially booster shots, doing this annually like we do for the flu. I mean, what are your thoughts on that, Dr. Argy?
So we just don't know. I mean, the ball is still up in the air and we don't know when it's going to land. To date, I mean, I think the longest period of time, even the original 30,000 who got the vaccine, and now we're into the hundreds of millions of people who've gotten the vaccine. So the longest time period we've had it out there is not much more than a year.
Right.
So how do you predict whether it's going to last a year and a half or 2 years until you get to a year and a half and 2 years? So far, the immunity seems to be pretty strong, even in those who got it 9 months ago. But like, for instance, me, I mean, I only got it 2 months ago. So, again, I'm not going to know whether I'm potentially at risk and whether my antibody titers have gone down until, another year from now. And then hopefully we'll have the experience of all the people who got the vaccine before me. So just historically, coronaviruses do tend to change and immunity does not tend to be lifetime. But everything, we don't know. We will find out, and we we'll probably end up getting some kind of a booster. That's not a bad thing. That's a good thing.
Right. I mean, these things are going to take time, and I can almost feel the impatience. People are, very impatient at this point. We've all been either locked down, working from home. Everybody from the credit union space to the medical space, everybody around the globe has been affected by this period. It's not a United States thing. It's not a political thing. That makes me insane. This is not a political thing. This is a medical thing. And that's why we're talking to you. You're a medical expert. So, sticking with the booster thought and things about variants, I mean, there are still a ton of people that won't get vaccinated for one reason or another. Why do you think that is? Fear or media?
No, I think this is media. I mean, if there are tens of millions of people who believe in conspiracy theories, if there are tens of thousands of people who believe the world is flat, or that the Holocaust was a fake and the moonshot was fake, there's going to be people with, we can call them charitably, fringe beliefs that are not science-based, that are not objective. We hope that education makes the difference, but it doesn't. And we live currently in a highly polarized political environment, so that we get people with really fringe views. And the problem is, I don't disagree that wearing a mask is an inconvenience. I wouldn't call it an infringement on your civil rights, or that, having to stay home, and not go out and not socialize is infringing on your freedom. Sure, we'd all like to go out, but you balance those infringements, which I would describe as minimal, against 360,000 dead U.S. citizens and millions in the worldwide who've died of this virus. So it's really, I think people need to be measured. I don't hear people protesting with placards, hell no, I won't wear my seatbelt. Hell no, I won't wear a helmet. Hell no, I'm gonna, drive 90 miles an hour. those are all infringements too, but we do them because they're prudent, they're reasonable, and they're safe, and they help the people around us. So hopefully rational thought will prevail. We hope.
Did you just say rational thought? How dare you?
I mean, it's a radical thought. Rationality has become a radical thought. But again, I mean, you just, when you hear the stuff that's going on out there in terms of conspiracy theories, and again, I don't even know if it's a lot of the conspiracy theories are just that for media hype, that they grab attention. I just wish that coronavirus and COVID-19 would grab people's attention so that we keep themselves safe, their friends and relatives safe, and the community at large safe.
I think it grabbed everybody's attention at the beginning, but then, the 24-hour news cycle and social media needs to feed on something. So remember the days when we're watching the 6 o'clock and the 11 o'clock news, and the rest of the day, I don't know, we worked or went outside. Now it's 24 hours a day.
Yeah, you're absolutely right. It's a 24
We're talking with Dr. Nick Argy. He is a physician. He's a lawyer. He's got a lot of good, vision as far as I'm concerned, as far as we're concerned on what we're doing with the coronavirus. All the credit unions over the past year plus, along with every other business in America, has worked really hard to try to get through this. Figure out how to work from home. Figure out how to do things remotely. How do we do things digitally now? More importantly, like, how do we survive as Americans and as, the human race? This is going to be a kind of a tough maybe question, but grade America at this point from where you sit on how we are doing.
So in terms of public health interventions, I would say a D. We get an A for vaccine development. So the technology was A plus actually, but we couldn't do the simplest of things, which is keep people isolated, get them to wear masks, and socially distance effectively. The perfect example of that is China, and there's a bunch of other countries. Australia is another great example of countries that didn't have a vaccine, don't have high vaccine penetration to this day. China, which has 1.4 billion people, so 4 times the U.S. population, has 5,000 deaths from COVID-19. We're, I think, at 370 now. 370,000 deaths. So, and they didn't have a vaccine. They didn't get the vaccine any sooner than we did, and yet they're 2 orders of magnitude lower in terms of deaths because they engaged in simple. And Australia, the exact same thing. When Australia told their citizens shut down, they shut down. And what is even more bizarre was people kept talking about the economics. We can't shut down, it'll crush the economy. And what we ended up doing was just prolonging and crushing the economy even more. Their economies are thriving because they didn't have to shut down, because they shut down their economies because they were able to effectively, using non-pharmacologic intervention, meaning stay home, social distancing, masks, were able to contain the virus. So their economies are doing very well, as opposed to ours, where we're still fighting as to what can open and what cannot open.
I hope the people watching this are taking notes. They're listening. They rewatch this, because that's, simple things. It really is simple things. Had we done that from the beginning, I believe we wouldn't be sitting here May the following year going, what the heck is still going on? There's a lot of other problems in other countries. There's a much bigger than you and I, but for the purpose of, this conversation, we're talking to Dr. Nick Argy. He's a physician and a lawyer. The grade, you said it right there. We get a D. We're not doing the right thing. Sure, we pumped out a vaccine, but we can't seem to stay away from each other. And now, as everything opens back up, I feel like this summer, of course, I want to get out and see a baseball game. Do I want to be front row at a concert where I'm elbow to elbow with people again just yet? Not just yet. When I get to that point, I'll get to that point. How do you think, what else do you think Americans can do right now to really put this thing to an end?
Well, it is staggeringly simple, okay? And I'm just going to use an analogy which is not 100% accurate, but it's about 99% accurate. If the virus has to be transmitted person to person, which we already have established, aerosolized spread, very little spread by fomites, which are inanimate objects. So touching something and then touching your mouth, we originally thought that was a big deal. It's not. It's aerosolized. And it's not just droplets. It's aerosolized, which are tinier particles. So if it takes person-to-person transmission and the incubation period is anywhere from 7 to 12 days, what happens, again, if we were able to just freeze people in whatever spot they're in for 12 days so that you literally can't move or go anywhere, and you have to sort of live with whatever is in your surrounding area. Well, that means, and again, there are a couple of tiny exceptions, but not significant, that if you just stay put for 12 days, the pandemic is over. It ends. The virus has nowhere to go. It's gone. It's over. So the only exceptions are people who are currently infected and may secrete the virus for longer than 12 days,
Right.
and then people that they're exposed to. But that is the minority, and those people are pretty much already known because they're in hospitals or they're being tested. So
Right.
I would love to get down to the point which Dr. Brilliant talked about, which is where we're doing containment, which is exactly what Australia and China did. So you test aggressively, you contain the virus, which with the technique I just described and which they used. And then if there's a small outbreak, then you do source contamination and source identification and tracking, the same way we do for many different diseases. If for instance, sexually transmitted diseases, you find out who the partners have been, and then you go out and basically do control the disease that way and make sure all those people are isolated. So anyway, it's simple, it's straightforward. If people were ever told that from the beginning, I think they would have had a very different attitude about wearing a mask and staying put. And if they were promised, which we could have with almost 99% assurity, that the economy would reopen up, and then we would just hit hotspots, find the hotspots, contact trace them, and fix the problem. I think this probably would have been gone 9 months ago.
Talking to Dr. Nicholas Argy, a lawyer, a physician, good friend of the show here, good friend of the CCUA. So basically, you're telling me our parents were right when they said sit still. It always goes back to that.
It really is it's the simple things, and if you keep it simple and stupid and you keep people aware of what they need to do to succeed, I think most people will do it. But it became very political. I mean, and our ex-president certainly didn't help the cause by flouting. I don't look good in a mask. It's not presidential to wear a mask. I don't want other world leaders to see me in a mask.
Yeah, that's a whole different conversation.
Wow. Yeah. I mean, don't you want to set an example and save 370,000 people from dying? I guess, no, looking presidential was more important.
Right. Talking to Dr. Nicholas Argy, lawyer, physician. Welcome to Marketplace Mondays in May. This interview, plus all of our interviews, will be on the feed loop throughout the entire month of June, so you can go back and watch it if you weren't able to catch this live. I want to wrap on this question, Dr. Argy. What, in your opinion, is going to be the new normal?
Wow, that's just such a great. I'm so happy you asked that question, because about a month ago, I drafted a resolution for the Massachusetts Medical Society and it's being forwarded to the American Medical Association, that we endorse the use of masks for all respiratory pathogens, especially at high-risk times of the year. Look at flu. Flu has been, the deaths from flu, which kills anywhere from 20 to 60,000 people a year, have plummeted because of mask wearing. So I think it's a great idea to wear a mask, especially if you're elderly or you have risk factors. Masks are a godsend, and I think we need to change the practice. The previous resolution I wrote, which became moot because of the pandemic, was that doctors in their offices should always offer masks in the waiting room. Then the pandemic happened, and I sort of said, well, we don't need to get that resolution passed. But no, we will have a new normal. And I'm delighted that telemedicine has taken off. It's so much safer, so much cheaper, and highly effective in a large number of cases. So masks and telemedicine will keep people healthier and happier. And I think we need to sort of adopt a new normal of being cautious for all respiratory pathogens and caring about our brothers.
That right there is Dr. Nicholas Argy. I can't thank you enough for taking time, coming back on Marketplace Mondays. It's always great catching up with you and talking to you. And hopefully the next time I talk to you, I can actually see you and come see you in person.
That, from your mouth to God's ear. I love it. That would be perfect. Thank you again. It's always a pleasure.
You got it. Thank you so much.
Take care. Be safe.